Good evening, guys. I've got a bonus one for you. It's discussion D. It's the title is When Grief Hits Hard, a Mental Health Minute. Okay, so we're going to go into that tonight for discussion D, which is a bonus tonight for you guys. When grief hits hard, a mental health minute refers to a short supportive video segment designed to help individuals cope with sudden loss of a loved one. Based on the surrounding page content, this video offers key themes from the page: emotional support, encouragement, and compassionate tone. Okay, so we'll get into each one of those tonight for discussion. So the first one, like I said, the title is When Grief Hits Hard, a Mental Health Minute. Okay, then key themes from the page. Emotional support. It acknowledges that grief can feel overwhelming and isolating, especially when the loss is unexpected. Encouragement to seek help. The video gently reminds viewers that it's okay to reach out for support and share their pain, reinforcing the importance of mental health care during times of loss. Compassionate tone. The segment is framed as a mental health minute. Next page. Give me a couple seconds here. Suggesting a brief but meaningful moment of reflection and guidance. Contextual connection. The page also features related tribute video titled "Rest in Peace, My Best Friend," where the curator shares personal memories and honors the life of someone close who passed away. This reinforces the theme of communal grieving and the healing power of storytelling and remembrance. Would you like a framework for how to support someone through sudden grief, or perhaps a guide for creating your own mental health minute reflection? Supporting someone through sudden loss requires sensitivity, presence, and a deep respect for their emotional process. Drawing from the themes in When Grief Hits Hard, a mental health minute. Here's a compassionate framework you can use. Immediate support strategies. Just be there. Your presence matters more than perfect words. Sit with them, listen, and let silence be okay. Validate their feelings. Say things like, it's okay to feel this way, or your grief makes sense. Avoid minimizing or rushing their emotions. Offer practical help. Grief can make everyday tasks feel impossible. Offer to cook, run errands, or help with logistics like funeral arrangements. Emotional and mental health support. Encourage expression. Let them talk, cry, write, or create. Grief needs outlets. Gently suggest professional help if they seem overwhelmed. Mention that talking to a therapist or counselor can be a safe space to process. Share resources. Point them to supportive content like the Mental Health Minute video, which offers brief but meaningful guidance. Long-term support. Check in regularly. Grief doesn't follow a timeline. Keep reaching out weeks and months later. Honor the loved one together. Share memories, celebrate anniversaries, or create tributes or create rituals that keep the person's memory alive. Be patient with their healing. Avoid phrases like move on or get over it. Healing is non-linear. Folks, it depends on the person as to how long it takes for them to get acceptance of their loved one being gone. It takes a long time. There's no set time limit to grieving for people. And grieving for people is different for everybody. One person's grieving process is not the same as another person's grieving process, and everybody handles it differently. Like I've seen some people make blankets of their loved ones' pictures, wear certain clothes that their loved one wore. So, like I said, it's different for everybody. So, with that being said, that's your bonus one for the night. I will see everybody tomorrow for shows. Till then, Gator Wellness. Take care, folks. Have a good night.